Dr. Dargan, thank you so much for being here with us today. Would you start by telling us who you are and what it is that you do?
Thank you for having me. My name is Dr. Halima Dargan. I am a licensed professional counselor, a school counselor by training, and I am currently an assistant professor at Long Island University, as well as a clinical supervisor, and I do a little bit of practicing on the side as well.
Excellent, excellent. That sounds very exciting, both being a clinician and also being a scholar. So I'm sure that that's very exciting for you. What we'd like to know today is what has been your involvement with CREST program?
Yeah, so while I was working in the community-based setting as a director, I was supporting a team of about 25 to 30 school-based mental health professionals, as well as child and adolescent psychiatrists and early childhood clinicians, and doing that work primarily serving the Latinx and Black communities. I thought it was really important to make sure that we serve them in a way that honored all of who they are, and CREST programs has been really instrumental or was really instrumental in training our clinicians that serve those populations to decolonize their practices and to really bolster, I guess, increase their skills in serving populations of color.
Wow, thank you so much. We really enjoyed working with your team. They seemed to catch on very easily. They responded very well to the idea of decolonization and mental health. They understood the relationship between that and clinical effectiveness. And they were just a lot of fun to work with. Was there a part that was most helpful to maybe you or your team? Can you think of one aspect of the training that we provided that was most helpful?
Absolutely. As you mentioned, I was really like an admiration of my team for the work that they do because they are really intentional about staying up to date on best practices. And so it was very, very helpful to have CREST program come in and support them. I wouldn't consider them like introductory or beginning level clinicians. Weren't quite advanced, so somewhere in intermediate. And I think that the programming that you all provided, number one, being in person. So being able to come in person for that second portion of the training was very helpful. Our clinicians really enjoy that hands-on interactive training because again, they do a lot of that on their own, which I was really proud of. So to be able to have this high level training in person was very helpful for them. But I think maybe the biggest difference from other trainings, the biggest takeaway were the tangibles, to be able to do those hands-on activities, but during the training, but to also get the assessments that they could use, the literature that they could refer back to, those kind of things. I think that you don't usually get, or you don't always get from trainings, even the ones that are in person. And so they can always reference those materials. And I think that was the biggest takeaway for them. Again, as a group of intermediate clinicians who have access to so much information, being able to go back to those tangibles and to know how to use them was probably the biggest takeaway for the team.
Yeah, I remember working with them, and they really embraced, for instance, we brought examples of race-based stress instruments. And a lot of times when we're providing the webinars, so a lot of people attend our webinars that are free, and we often remind them this is just knowledge-based. What you need are new skills to have. And so when you either contract us through the online or ask us to come and be in person, we can bring with us new tools and resources, show you how to use them, and then leave you with them. A lot of times we talk about race-based stress inventories, and people say, well, I've never seen any of those. When we bring them and then demonstrate how they're used, that allows them to walk away with new skills and new ways of doing things. So I saw them very excited about that. That was really great. Were there particular issues that they were dealing with that made you think, wow, I need to have a culture-centered, trauma-informed care perspective?
Um, Nothing new per se, but the population that we serve, again, is primarily Latinx and Black students, Black children and adolescents. And so the work we're always doing or always needing to do trauma informed, culturally centered work. And it was really important to me as the director at that time to move them forward in that way. And I believe that CREST program was able to do that, to kind of elevate um, what they were already doing, to give them additional skills on top of, that baseline of knowledge that they already had.
Mm, mm. So I guess again, this emphasis on culture-centered trauma-informed care because we are the only company in the United States that is both culture-centered in the trauma-informed care that we provide. And so people respond very well to that. What would you tell someone else, a colleague perhaps, who had a team and had similar kinds of issues? What might you tell them about the work that we do?
I think I encourage them to one to start with the online materials because they are easily accessible and easily digestible. Even with as much or the quality of information that is provided, it is provided in the way that, again, even the I guess beginner clinicians or fresh out of grad school, or and even those who have been in the field for a really long time can get value from. So I would say the services, the programming, the education is easily accessible. Um, it is, and this is to the in-person aspect of it. I think just the person piece of it. It was great to have you um, as a trainer in that way, and I think the clinicians getting to see you and know you and engage with you in a way that didn't feel think of the word, in the way that didn't feel intimidating in any way, like having this presenter here with this knowledge base. And our clinicians and my colleagues at that particular time are not people of color. And so to be in a space where they felt like someone was there to teach them, and not to belittle them for not having the information. I think that's probably one of the bigger pieces that I would share with my colleagues.
Wow, you said a lot with that. You really did. And I am humbled by it, actually. So, yeah, that is great to know that in working with teams, because a lot of times we have people who do not, identify as Black or African American or someone of African descent, and yet they are working with Black and Brown children and they are looking for effective tools to be able to resolve some of the issues that the students are dealing with. And so sometimes they might feel intimidated and think, well, maybe that's not for me, or maybe she's not talking to me and so on. So it is very humbling to hear that they felt very relaxed and comfortable, and that we were very inviting and appreciating whatever level of questions that they had, whether they were people who were very competent in their multicultural skills or they're just starting the journey and so on. So that is really great to hear. I really appreciate that. Also, yeah, it's good to hear that what you decided, that wasn't something we decided. You all decided to start online. And, when you called me and said they loved it, they want more, and they want us in person. So that's a good thing to recommend to people to maybe start online and get some of the information and use it, talk about it, in
Mhm.
staff team meetings, and then plan to have us to come and be in person. Those are really great suggestions. I appreciate that. My last question is, can you just provide, just for, viewers, people who perhaps are either clinicians themselves or are supervisors at agencies, can you just give an overall impression of CREST program that they would want to know? If they want to know, what is this thing? What is CREST program? What's your overall impression?
Absolutely. I would absolutely say that CREST program is who they say that they are, and that they are an organization that provides culturally competent, trauma informed, quality training to us, that did provide these services to us, and that you all are an organization that, one, you care. It's clear that care for the work is there. I think sometimes that's missing in a lot of these trainings. It could seem like kind of reading off of a script and hitting bullet points, and I think it's clear that you care about the work. I think that Crests is expansive in the education that they provide, and we mentioned the from the online work to the in-person work, responsive, and that it didn't take much time for us to communicate and kind of work out the logistics, which I know can be really important for organizations, large and small. And overall, I think what I think is the most important is that you are competent in what you all do, and you provide what you say you provide. You are reliable, and that we get exactly what we pay for, if we're going to be honest about that. And even more so. And I cannot overstate how valuable those hands-on materials are, those tangible materials are. And I think that that again is kind of what sets you apart, particularly in this area of the work that we do, because it's really hard. It shouldn't be, but it is really hard to find some of those materials. And so I think that is also, again, one of the biggest takeaways, and why I'm glad that we chose Crest.
Thank you. Thank you so much. We really enjoy working with your team, and we hope that we can collaborate with you in the future in your new roles.
Thank you.